Hi, welcome to the universe of cardiology, the study of the heart. This is Dr. Jaitly. I'll be talking to you very briefly in this video presentation about what is heart transplant. Now, we know it's very uncommonly performed, but just so that I put a number to it, it'll be about 3,500 or over heart transplants are done now per year across the globe, the entire globe. Half of which, or more than half of which, are being done within the United States. So obviously, the United States has the highest number of heart transplants happening within the country, and the rest is all happening in the rest of the world. So we have the largest experience in the United States, and chiefly major medical centers where cardiologists, surgeons, interventionists, intensivists, anesthesiologists, they comprise of the biggest team, and then the people working behind the scenes, including nurse practitioners, physician assistants, and social workers, and dietitians, and what have you. So it's a village. It takes a village to really, I always say, to perform a heart transplant. Now, it is offered to an individual with end-stage heart failure or someone who has obstructive, very severe form of coronary artery disease that's not bypassable or angioplastiable, if you will, or so that there's no way that you can do angioplasty or offer a stent or even any surgical intervention is not possible. So those are the cases who have failed the treatments despite being on an ICD or implantable cardiovascular defibrillator device, as that's called, or patients who are awaiting to be matched while on waiting list and have received an LVAD, which is the left ventricular assist device, as a bridge. So all possible treatments have been exhausted to treat the heart failure and the obstructive coronary artery disease of a severe advanced nature. Then only the patient will be placed on a transplant list, which is a national waiting transplant list. Now the procedure is, without delving into the real surgical techniques of the procedure, but the fact is that the principle is the following. The heart, look at the right panel here. Half of the left atrium and the pulmonary veins are left intact in the recipient. Rest is all removed. That means the vena cava, the right atrium, the right ventricle, the left ventricle, obviously, and the lower half of the left atrium. So all of this is removed, and the new heart, which is the donor's heart of presumably a healthy heart, somebody who has registered himself or herself as an organ donor, and fortunately has deceased. So the cadaveric heart, as we call it, is immediately shipped out to the destination where the recipient is awaiting a heart transplant, and then the teams of surgeons immediately, both from the donor's heart and from the recipient's heart, to get together to perform this surgery. So as I said, it takes a village to really perform a heart transplant, and then the people working behind the scenes and extended personnel involved inside and outside the operating room, and then the postoperative course, which is very, very tumultuous sometimes. But then, as long as one is very, very thoroughly performing the art of postoperative care, which may require sometimes interventional or non-interventional assessments, the patient's outcome will depend mostly on how well the whole program is built. Postoperative survival for now is about 15 years on an average, and 85% of the patients celebrate their first anniversary on obviously on their first year, and thereafter there is a fall of 5 to 6% per year. So the fall rate, but 85% will make it through the first year after the transplant. So the success has really improved over the past at least 15 to 20 years in terms of a heart transplant, the screening, the assessments, the immunosuppressive drugs that go in postoperatively to alleviate huge problems which are still existing though, but the numbers are much lessened. And of course, needless to say that some of the side effects, unfortunately, from the drugs or the medications postoperatively that the heart transplant recipient receives are also causative in some serious adverse effects. Specifically, the kidney damage can result from certain medications that are given for immune suppression, during the times of postoperative heart transplant case. Now, so the commonest problems are obviously earlier rejection in the donor heart and the biggest problem is also a sepsis, an infection can occur. However, the patient has to be screened for several systemic illnesses like insulin-dependent uncontrolled diabetes mellitus, or many other systemic conditions, cancer, for instance. So those patients cannot go on to receive a donor's heart. And likewise, from the donor's point of view, the deceased person has already been screened earlier that there is no systemic illness really that will contraindicate the donor's heart to be placed into, be available for donation. What else can I say? I will tell you that atherosclerosis of the coronaries of the donor heart can still recur, and sometimes they occur very progressively and more acceleratedly, and that is yet another complication. And not infrequently, the person is replaced back on the heart transplant list, and people have performed a second heart transplant in that individual if that problem arises, because the coronaries can be very progressively atherosclerotic, and at that point, as long as tissue is matched and the blood is matched while being on the waiting list, one awaits a full treatment to be offered while still on the transplant list. Now, the heart failure treatment, specifically so in the advanced heart failure phase, it also includes putting an implantable cardioverter defibrillator, as it's called, ICD, or LVAD, which is the left ventricular assist device, in order to bridge the patient to receive donor's heart. So it is an expanding horizon on heart transplant. Obviously, it's extremely expensive. So cost effectiveness has to be borne. But the fact is that very select few patients who have met the criteria can be placed on the national waiting list, and sometimes the waiting could be long, pending the matching of the tissue as well as the blood. I hope you found this interesting, and I thank you for your attention, and have a good one.